I was recently at the ANDHealth Digital Health Summit 2024 in Melbourne to hear from innovators, investors, and industry champions who are changing the healthcare landscape for Australia and beyond. So we know the future of healthcare is digital, with cutting-edge technologies holding immense promise to transform healthcare systems and to improve patient outcomes and close the health equity gap. But how do we deliver on this promise and take innovations from new frontiers to frontline? That's what we explored at the ANDHealth Summit, and the sessions are notoriously Chatham House rule, so you'd have to be there in person to catch the sessions. You're not allowed to record them. But between things, I managed to catch a number of speakers to get their take on the topics discussed to bring you this feature episode of Talking HealthTech today. You're going to hear from Liz Ashall-Payne, Chief Executive Officer for Orca, Christopher Bain, Professor of Digital Health at Monash University, and Megan Robertson, Group Chief Research Officer at St Vincent Health Australia. Special thanks to THT Plus partners ANDHealth for helping bring you this episode today. Make sure you go and check out their listing on the Talking HealthTech website for other episodes featuring ANDHealth and their companies, as well as checking out news, events and jobs that they've shared with our network. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
So Chris Bain's my name. I'm Professor of Digital Health at Monash Uni. Been there the last 7 years. I have what's called a practice professor role, so it's a bit non-traditional. A lot of industry outreach, strategy, talking, overseas visits. My background's in medicine and IT before coming to the uni.
Yeah, super duper. There's of the over 500 episodes of Talking HealthTech, there's this list of people that is I can't believe they've not been on the podcast before. And you were on that list, so we can tick that one off at least. But hey, look, I was just checking out a panel here at the event and we were talking about regulation, policy and a few other things. It was really interesting hearing other parts of the world. I'd love to get your reflections on that, because there was a few parts that I really kind of tuned into your side about involving clinicians. It was pretty wide ranging. So what was your kind of summary of that one?
Yeah, look, a couple of really good things in that for me. One was to hear people from government, HTA, talk about a willingness to actually go, we could work with that. Our process might pick up part of that digital health stuff. So that was really good, because if you're not involved with them, you don't know them, you get a sense from afar that it's all a bit too much trouble and it'll be over their dead bodies kind of thing. So that was really reassuring. Liz was a highlight for me. I was well aware of her, well aware of Orca. I may have heard her talk in a big conference before, but actually being on the panel and hearing her talk at the start, especially about those 5 lessons are very valuable, and then putting them into play around the DIGA scheme. So DIG is one of those things I've sort of had an awareness of in the last 12 months in particular, and I thought, wow, that's a great model for us to think about and look at and be able to go to our government agencies. Look, governments around the world are actually doing this, but she was able to point out some of its downfalls and the fact that it sounds like a failed scheme, but we have things we can learn from it. So that was another big highlight of all that for me.
I liked that. I think she had on a slide, there was a few different regulatory frameworks or approaches that countries have taken, and no one's kind of nailed the entire thing, but if you kind of draw inspiration or steal from others, you'll be able to kind of come up with a collective outcome for those that, aren't fully across. So we're talking about, regulation in this fast-paced, I guess, digital health / AI emerging space where innovation moves quickly, regulation doesn't move fast enough. Is that right about?
Yeah, correct. And tied into that is then reimbursement. So, we've got 75% of our healthcare in Australia, from stats I've seen, are paid for by government. That's sort of wiggling upwards slowly. If you compare it to the States, they're like 55%, which fits with our perception of their system. So if we want wide-scale digital health adoption, most of it's going to be paid for by government. And the reason I say that is every time we make a noise in the Australian population about changing Medicare, we know what happens. So no one's got an appetite to suddenly pay more for their health care. Mm-hmm. So I can't see how at scale it's not government paying for it.
Yeah.
And so, government deals with HTA. That's why I've sort of come to that conclusion a bit myself. It's not a perfect fit. There is that sense of shoehorning, but other agencies around the world are doing the same thing. So the people in HDAI, the people in ISPOR, these organisations affiliated with health economics professionals are looking over at digital health going, we need to be part of that game, and they're starting to do work in that space. So, yeah, a lot to happen still. It's a fast-moving area, as you say.
Yeah. Do you think another element of the complexity that we have in Australia is that whole state and federal divide, the outpatient by the federal and the hospitals on the state side? Sometimes it can feel a little bit like this is someone else's problem. It'd be great to have a bit of ownership.
Absolutely. I mean, I saw that when I first practiced medicine at the REPAT hospital in Melbourne in 1991, because they were a federal funded thing at that time. And then there was this argy-bargy about how many scripts we would give people when they left the hospital, and they cut down because that was one part of government paying for it, and it shifted the cost to the other side of government, 30 years ago, right? So it's always been a thing, and I think it doesn't play well for us.
Yeah.
We talked about this a little bit. States, in a way, I mean, amongst the many complexities there, and one of them's funding and control, states can sort of go, well, the federal government hasn't regulated this, or the federal government isn't clear on this, therefore we won't do anything. And it just causes inertia.
Yeah. Something I kind of took, I think Liz mentioned something like that, that there's clinicians showing patients apps already, and consumer expectation is that there'll be more healthcare in their hands. I'm paraphrasing, but I think we're seeing it in other areas of healthcare too, where there is good technology that solves real problems, like we see it in the AI scribe space in the GP element, is that regardless of the level of regulation that we have, if something is good and it solves a problem, it's going to get adopted. So in the past, I think we've talked about how regulation is slowing down innovation, but if anything, if there's a good solution, then regulation is going to have to keep up, because then safety comes into play and everything too. So they tie in together, but there's definitely inspiration to move now. We're into 2025 now, and you've got many plates are spinning. Where are your kind of priorities at this year, or what are you looking forward to in this fun digital health space?
That's a really hard question.
That's what I'm here for.
Another exciting year. I'm really fascinated to see what happens in the AI scribe space. There's a lot of really positive anecdotal evidence out there, and I believe in those things. That's being countered by people, even in senior visible government positions, canning Gen AI. It's like, well, there's a reconciliation needs to happen there. We shouldn't have Gen AI roaming through the healthcare system unchecked. That's not what this is, though. This is a very specific use case, solving a long-standing problem which has caused burnout around the world, and it seems to be working. So how that plays out is going to be interesting. I think there's a whole underdone area, and some of the slides this morning reinforced that whole VR, AR thing.
Yeah.
I think there's going to be much more growth in that. I'm just interested, if we talk about the ADHA's three digital horizons, so digitisation, digitalisation and digital transformation. Every country I speak in is playing in all three, and health type stuff is up the digital transformation end, seeing our sector move collectively more to that digital transformation end in ongoing ways is the other thing I'm interested in. I think I've mentioned a bit today, I've got a real focus these days on value-based digital health. So turning that vision, that conversation into more tangible realities, tangible tools, tangible translation of evidence is something I've got to try and achieve next year as well.
Liz Ashall-Payne, founding chief exec at Orca.
Liz, thanks so much for joining me here today. It's great to have you here. Tell me a little bit more about Orca and what brings you here to Australia and also to this event.
Yeah, of course. So I founded Orca 10 years ago. Background as a clinician, felt really frustrated with the fact that as a clinician, you can only see one patient at a time. not from a technology background. I was fortunate enough to work with lots of boards and in lots of different parts of the healthcare system, and started to see the opportunity that digital and digital health could present to provide access to healthcare to more people quickly, not least because we all have the smartphone in our pockets. I was equally excited and frustrated by the opportunity. Frustrated because of the barriers that were there. Biggest barrier, of course, being trust. Nobody knew which technologies were safe or effective. Lots of other barriers, but that was a big barrier. So ultimately started thinking, well, how do we get other things to people in healthcare? And an obvious thing to think about is drugs, pharmaceuticals. So the way we get drugs to people is we prescribe them, or we go to the chemist and we buy them over the counter. But before we do that, they're tested. We have a workforce that's trained. We then have access to knowledge about these drugs and a prescription infrastructure. So Orca was founded on those principles. And ultimately, over the last 10 years, that's the system we've built, where we assess and assure products. We then create awareness and workforce development, online platforms, and then create distribution channels, digital health libraries and formularies. From a formulary, you can prescribe a technology and track with reimbursement. Now, why am I here? We have been, I suppose, I don't want to sound egotistical, quite pioneering really in the work, and we're quite unique. There isn't really anybody else on the planet who does what we do in the way we do it. There are people who do bits of it. And so I've been really fortunate in that I get asked for my opinion because I've trawled the world looking for people who are interested and who know about this space. And so I'm always able to share lessons learned, what's gone well, but what's not gone well. And I was invited by ANDHealth and Chick to come over as an international expert in residence. So have had such a privilege in meeting lots of people from the ecosystem. And obviously today, again, very privileged in being asked to give the opening keynote.
Hey, that keynote was great too. I wanted to dive into that in a second because there were some really important lessons that you shared there that I wouldn't mind you unpacking a little bit. But I wanted to go back to your point earlier that, you know, there's no one really doing what you're doing. And I'm sure there's many reasons why. But one reason I would imagine is because if I look at the App Store, it's like there are some good apps in terms of healthcare solutions for patients. It's also a bit of a dumpster fire of like random stuff too. So curating or assessing or doing that, it sounds like a hard gig because there's many new apps kind of popping up, and I feel like the use of applications in day-to-day can sometimes be through different channels, like where, like you mentioned the prescribing thing where, medicines, that's quite a clear kind of pathway, but someone could recommend something to someone else and the word of mouth. So trying to put some guardrails around that, that's a real challenge.
Yeah, no, I 100% agree. And I cannot underestimate how difficult this journey has been. And quite a few times I've thought, I can't do this. We're not going to do it. But I think what we tried to do was learn from others who tried and also be really honest with ourselves. So I'll give you an example of that. In the first 18 months, my whole mission in that first 18 months was to create the world's first digital health library full of evaluated technologies. And I wanted to get to 100 technologies. Mm-hmm. So we did it and we launched it. And then I looked at everything and thought, everything's changed. Every single product has incorporated a new function or feature, and the regulatory landscape's changed. Yeah. So I'm back to square one. So what I did then was I said, no, what we need to do is stop. Let's think about this in a different way, and let's use technology. We're assessing technology, let's use technology. And so what we did was we built a review engine. The review engine starts with a daily data scrape. What's out there? What's on the Apple App Store, the Google Play, but what's out there far broader. And importantly, has anything out there that we've assessed changed? Because if it's changed, we need to reassess it.
Yeah.
So what we built was a review engine. It's still a manual process, but it's highly engineered. So it's 5,000 times faster than other people who do it. Everything's date stamped and held in the compliance portal. And when a reassessment is triggered, we only reassess the bit that's changed. So we're able to provide ongoing compliance. And what I'm trying to do now is say to systems, don't feel like you need to build this technology. Just use ours. If you want to do the assessments, please feel free. Use the technology that we've built. We don't have to do all the assessments. So that's an example of, I suppose, our ability to be agile in this crazy, ever-moving world of digital health. But of course, you have to have a connected system at point of distribution. And to your point, it's not just about healthcare professionals prescribing or me or you going to buy something. We have other ways of distribution. And so one of the things I was saying this morning was we have to focus on the problem. Who are we trying to help and where are they? Because if we're talking about kids, they're in schools, they're not in GP practices, they're not in hospitals, they're in schools. So let's work with schools to be our distributors. If we're talking about helping the workforce to stay healthy and well, to keep our economy going, they're in work. Let's work with our employers. So I 100% agree with what you're saying, and we have to think a little bit more laterally about health is everybody's business.
Yeah. Well, it kind of ties to a kind of a recurring or an underlying theme I'm getting from you, from your presentation, even from the discussion here, is I think when we're looking at different regulatory frameworks from countries, we can see there's a bit of good in every location. So potentially some countries can draw inspiration from others. And as you say, you don't have to be the sole provider. Let's lean on each other. I'm getting a strong desire for collaboration in the ecosystem.
100%. I mean, collaboration is king. I know what we're really good at. But we don't want to be good at everything. We're never going to be good at everything. So I'm really keen to bring what we've built and what we've learned over the last 10 years to the ecosystem and say, how could this help? How could this help where you are and what you want to achieve? And by the way, there are hundreds of other people who will be standing there saying, I've built this. How can this help? And so collaboration is absolutely critical. And focus on the problem. These solutions are going to change over time. But if we focus on the problem, we won't get worried about the solution because we're all aiming to improve that problem that we've agreed.
Yeah, no, that's great. There was, you also had in your presentation a few key recommendations or lessons learned. If there was a bit of a whirlwind tour of those, what are some of the key things you'd hope that kind of stuck with attendees that caught the presentation today?
So I think just cutting to one, this is about a system and not a standard. A lot of governments particularly get stuck in thinking I need to create a standard or a regulation. It's really important that you've got clear criteria to build trust, but having a system of applying that criteria and distributing the great products and reimbursing them, that's where we're going to see true impact. Because the thing that I said this morning, which still is my big mission, until somebody's benefited from and had that technology in their hand, we have literally done nothing. So let's keep the focus on benefits and impact for people and patients, and don't focus on a standard, focus on a system.
Yeah, I love it. And lastly then, so for Orca into 2025, sounds like you've continually evolved and grown and got this great thing now. Where to from here, and what's on the horizon for you, and where are you most excited to kind of take what you're doing?
It's a bigger impact, and we're very, very mission driven. If you go to our Orca's intranet, the first thing you'll see is the impact. So the number of lives impacted positively. I want to do more of that, ultimately. Yeah. That's my big measure of success. My other big measure of success is people are everywhere on the planet. So yes, we already do a lot of work in lots of different countries. I want to do more with more countries. And ultimately, my big measure of success is how can I help countries that are maybe not as privileged as others. And so that will be my big measure of success eventually.
I'm Megan Robertson. I'm the Group Chief Research Officer for St Vincent's Health Australia, the Director of Research for St Vincent's Hospital Melbourne. I'm also an intensive care clinician, and I'm the Deputy Chair of the Digital Health CRC.
Amazing. Definitely a wide range of experience, perfect for the conversations here at the ANDHealth Summit. You were up on a panel and sharing perspectives, particularly relating to patient outcomes and the role of digital health, I believe. Tell me a little bit more about the discussions that took place there.
Yeah, well, we were talking more broadly initially about the role of technology. And, as an intensive care specialist, there is no doubt that technology has transformed care over the time that I've been involved in clinical medicine. Now, a lot of that is digital technology behind the fancy ventilators and things that I use. But now it's becoming more transparent. We're starting to see it in other areas. So unfortunately, there is still a huge gap in how broadly it's available, but there are very basic things where you can see the transformation in healthcare provision and healthcare safety. So things like electronic medication prescribing. Now, actually, the easiest thing for a doctor to do is just scrawl a paper drug chart, but that's exactly what I mean. Scrawl it. And then someone else has to read it and work out what they've prescribed, what dose, and why it's being given. So things like that, you change to electronic medication prescribing, it's a little bit more clunky to do, but once you're used to it and once the machine is used to you and what you prescribe, it becomes so much safer. It's easier for the staff who are delivering it. It's easier to see when a drug dose is missed for some reason or something else. So that's a very basic example. There are more system-wide examples which can improve safety. So like in Victoria and a couple of the other states, we now have real-time prescription monitoring. So previously we used to know what you'd prescribed, but you didn't actually know what the patient had gone and got filled.
Right.
Okay? So that information didn't come together. That information is obviously kept for the pharmacy and the PBS and that sort of thing, but it's different to the information about your actual script. And particularly for drugs of addiction or pain medications or medications that are potentially at a high risk, I won't say of abuse, I'll say of people becoming dependent, you need to know if they're filling it, if they're getting prescriptions from multiple different places, if they're hoarding them, or whatever else. So real-time prescription monitoring is really important in terms of improving the safety of the community as a whole, as well as individuals.
Yeah.
And things like, to give you an example, as I said, I'm an intensive care specialist. So, I have had examples where people have come in, very, older people who've come in, they've given us a list of their medications, or the family have brought all their medications in with them, and something's happened that we've thought, and we'll check the real-time prescription monitoring and be able to find something else. Nobody else in the family knew they were taking, and yet that, if they withdraw or something like that happens, it can be a really serious issue.
There's something about having the information there, and whatever gets measured gets managed, and you can probably apply that into multiple different settings. So being able to apply that. I liked your point earlier about it might feel like to the clinician that it would be easier for them to just scroll something out and then pass it through to someone else to put into the system. Why would you front end load me with the data entry role? But as you say, as the technology gets smarter, as it gets to know how you do things, and as automation's brought in, it's not just shifting deck chairs on the Titanic, it's actually like optimizing the whole flow and most importantly, making the whole process safer.
Oh, absolutely. Not a question. It makes the whole system safer. The other thing is that, having what we need to get to with digital healthcare is an integrated, linked system. So the big thing at the moment is interoperability of the data sets that we have, proper usage of things like My Healthcare record, which is not great at the moment, and its uptake's not been fabulous. But we know that a lot of the mistakes and things that cause harm to patients happen at transitions of care. So you leave the hospital and you go home and you need to see your GP, and somehow the information that your medication has changed, or you had a reaction to something, or something else has happened in hospital, doesn't always get to the GP in time and in a format that they can actually utilise. So you could turn up to your GP And particularly for people who aren't especially health literate, but even for people who are, it's a complex system. You may not know some critical pieces of information that would actually make you much safer at that transition of care.
Yeah, I mean, given the breadth of healthcare that we have, the multiple stakeholders and points of delivery, the communication across those 2 points is critical, and having that data, being able to have that visibility, because that's, as you say, that's where it falls down, and technology plays a huge role in that. And it became clear in that conversation that those 2 things are quite closely linked in terms of, you know, patient safety and the technology side. In terms of you then, and in your various hats that you wear and looking into 2025, how's technology going to shape what you do, or what are you looking forward to in this space to apply into practice?
Yeah, so we're doing some interesting things. So the healthcare service I work with, we're looking at an EMR, so an electronic medical record. That will be implemented over the next couple of years. That's a huge change management process. And by definition, hospitals and healthcare workers are conservative because that's how we're trained to be. No, you don't want your doctor testing the latest thing he's read in the Herald Sun. You really sort of want to know that he's thinking about what's appropriate and what the latest data is and those sorts of things. So there's a huge change management plan there that will need real champions to pull that through. So I'd like to be part of that change. The other thing is some really interesting things once we get that data that we can do. Once you can put all that different data together, so we have pathology, radiology, admission data sets, emergency department data sets, and an electronic medical record, and they all sit slightly differently. If you can link all those in together and then give the patient access to their own data in language that is appropriate for them, you've got an enormously powerful tool to help people take control of their own health. So one of the projects we're doing at St Vincent's at the moment is looking at pathology reports. Now, pathology reports come out and they're typically sent to patients, but they're written for doctors. There's no explanation of what any of it means. You look at it and go, oh, yeah. Or my kids do because they're non-medical. So there's a whole program going on about how we make pathology results understandable and legible, if you like, to the patient themselves, because it's actually their result. So the electronic medical record and getting everything to talk to each other, getting some of the stuff to talk to the consumers so they can see what's going on. And then the third thing is synthetic data. So we're starting a program on synthetic data. So using de-identified health data, if you're using large amounts of it, is good because it's very unlikely that anybody would be identified. It's still possible though.
Sure.
So synthetic data takes it another step and it creates a data set that has the same qualities and parameters as the original one, but sort of not in the same way. So it's not identifiable. There is a tiny chance within a small data set of synthetic data that you could identify someone, but it's far removed from even just what we would use as de-identified data. Once we get access to that synthetic data, we can model all sorts of things, new ways of healthcare, new ways of providing care, new ways of picking up who's at risk. We see it in the paper all the time, the triaging at emergency departments. And when it fails disastrously. How do we make that better? So, look, there's exciting things. We've got to get the basics in there, but there's some very exciting things coming up.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.